have Liz Matney, who's the health policy advisor with the office of Governor Kim Reynolds and Lieutenant Governor Adam Gregg. We have Joel Anderson, who is the tax economic policy advisor, also with the governor's office, and they have an incredible story to tell. They very quickly pivoted during COVID, and Liz and Joel and their team have just an amazing story to tell. We have a lot of other great speakers today. We're going to learn about the Historical Society, Unite Private Networks, Bank Iowa, the list goes on. So I am excited to turn over the Zoom room and the virtual stage to Bailey first. Bailey heads up our marketing, social media, and our events. And I think this is probably your 100th event. Is that about right, Bailey?
That sounds about right. Awesome. It's funny. Yeah, Kyle with Bank Iowa was asking right before this what number luncheon this is for us. It's only our third luncheon virtually, but we've done a lot of other events. So anyway, so thank you, Catherine, for turning it and starting us out today. So thank you everyone for joining us for today's August membership luncheon. I'm going to quickly go over the agenda. So after I'm done speaking, Anna Dowd, our Director of Membership and Strategic Partnerships, is going to introduce our nonprofit spotlight, which is the West Des Moines Historical Society. We have Gail with us today. And then our sponsors, she'll introduce our sponsors then, Unite Private Networks and Bank Iowa. So thanks to them for joining us and making today possible. And then our board chair, Chris Nelson, he's joined us today, and he's going to introduce our speakers, Liz Matney and Joel Anderson from the governor's office. We'll have some time at the end of the event today for a Q&A that will be facilitated by Kara Matheson, our Director of Workforce Development. So if anyone has any questions, feel free to drop those in the chat box. And then at the end of the event, Nicole Langmaid, our accounting specialist, is going to go over some future events for the chamber. So other than that, just make sure to keep your mics muted and drop anything you want to say in the chat box. And everyone give a wave because you are being recorded. This will be posted on our YouTube channel and shared with everyone within the next 24 hours. So now back to Catherine.
Thank you so much, Bailey. Thank you, thank you. I am now excited to introduce Anna Dowd, our Membership Director and Director of Strategic Partnerships. And I tell you what, this chamber team are dynamos, and Anna, take it away.
Thank you so much, Catherine. Well, I am super excited to be able to introduce Gail Brubaker today. She is the Executive Director with the West Des Moines Historical Society. So thank you so much, Gail, for joining us today. And with that, I will hand the virtual mic over to you.
Sounds great. Thank you so much for allowing me to speak to everybody today. I am here at the historic Jordan House. We have a very small staff, so we're able to rotate in and out and spend time in this great building that thankfully was not damaged by the 100-year-old plus oak trees that are all over in our front yard. I wanted to speak briefly about the Jordan House and the Historical Society. And if you haven't been to visit us in a while, got a lot of reasons why you should. So let me share my screen. Apologize for any hacking away that happens with this PowerPoint. So we are celebrating 50 years in 2020, something that we're very proud of. And boy, what a year to choose to celebrate, huh? Nothing else going on. So the West Des Moines Historical Society was formed in 1970, primarily to save the Jordan House. It was in pretty bad shape, and we are at 2001 Fuller Road, and our most prominent marketing point and historical point is that James Jordan was the chief conductor in Polk County for the Underground Railroad. So freedom-seeking slaves spent time here on their way north to Canada. So I think it's something that West Des Moines should be really, really proud of. We are the only central Iowa stop on the Underground Railroad that is open to the public. So it's a rare and great thing. The other facility, museum that we manage is the Bennett School. It's one of the very last one-room schools utilized here in Polk County, and it's just down the road at 4001 Fuller. So it's a great place, especially for kids to come and learn about what school used to look like. Our mission, we are a volunteer-based organization dedicated to community enrichment through education, preservation, and celebration. Education is a really strong point, and our organization, like all other organizations, have had to learn to pivot. So we can't have large school tours in here. So we're working on other ways to provide education to the thousands of school-age kids who usually come visit us here at the Jordan House. What happens when you come visit us here? You're going to hear stories, you're going to see exhibits about the Underground Railroad, learn about that radical abolitionist John Brown and the time he spent here and the friendship that he had with James Jordan and the Jordan family. You're going to hear stories and see exhibits about early Iowa life, focusing on the Jordan family, early Victorian life, cooking, what life was like, and also their neighbors, including some of these crazy people sitting on the roof of the house in this picture from around 1872, 73. What's new? One thing that had happened when I first became executive director here is we, the board of directors and the staff made a commitment to putting in new exhibits. There hadn't been anything new at the Jordan House in decades. So last year, our very first new exhibit opened up. It's West Des Moines at War. Celebrates the contributions of Central Iowans, not just on the battlefield, but at home. So a lot of stories about medal drives and victory gardens and things like that, as well as really great pieces of history from West Des Moines. This is a new one. This was supposed to launch just this March, but again, we were shut down. So Profiles of Courage, these are the stories of 4 Iowa women who were integral in the Underground Railroad in Iowa. It was a project we did with a Valley High School senior who was also one of our Jordan scholars. No, that is not the actual height of those women. That's what we could afford to have printed. But they have some amazing stories, and the impetus of this was the stories of women are unknown in history a lot of times. So this young lady did a lot of research and discovered the lives of these amazing women. The one holding the saucepan is my favorite. You'll have to come hear about what she did with that saucepan. Hint, it was violent. The other one that we just put up is the Vandenberg Pharmacy. That was a pharmacy that was on 5th Street of Valley Junction until 1974. So there's some information about the Vandenbergs, about pharmacies and medicine. One part of that exhibit is Jordan family related, Dr. George Hannawalt's book of death certificates from 1880. It's absolutely fascinating to read about, we pulled out 4 different individuals who passed away in 1880, which is the first year that the state started requiring death certificates. So you'll learn a little bit about Native American cures, as well as the fact that opium used to be produced by bear to give to your kids. Who would have thought? And then this last one, rocks, fossils, and minerals. I am a nerd, so I absolutely love this one. These are fossils and petrified wood and some bison teeth, all these kind of things. This is really old West Des Moines history, definitely. There are many ways you can be part of history. Come visit us. The Jordan House Museum is open for tours on Fridays and Sundays. Tours go 11 a.m. to 12:15. Then we're closed so we can sanitize and clean every surface, and then 1 to 2:15. We only allow 10 people at a time in the house. We're keeping our numbers low for good social distancing. Tickets are available for both Friday and Sunday. On Fridays, there are 5 walk-up opportunities. On Sundays, if we've sold tickets and we're here, we allow walk-ups. No tickets sold, no staff here. So come see us. You can also bring your bubble. You can schedule a private tour or event or lunch or anything like that, Monday through Thursday or most weekends. So if you have a group that would like a tour and you all feel comfortable, bring your bubble to the Jordan House. Become a member. Membership started only $25. And this is the one way that we have consistent and reliable financial support for everything that we do in the next 50 years. So these are 2 of our members participating in Member Monday, which is a chance we open up the museum to at least 2 people, related people, and they get the full run of the place. So we leave them alone and they get to walk around and look at everything. We also have a new paver project, Pathway to History. It's a garden paver project. We will be installing them this spring in the gardens at the Jordan House. And it's a way to memorialize someone you love or a significant event or your family, and you will become a permanent part of this building. 1850 was the first part of the house. So we have a long history here, and you get to be a part of the history as well. Join the board. The board of directors, they provide guidance. We have a lot of fun at meetings, and these are the people that help set policies and frankly get to boss me around. So if you'd like that opportunity, you'd be more than welcome. You can join a committee. If you're not sure about joining the board, we do have volunteer committees that help with a lot of the day in, day out stuff. You need to get in touch with me. There is my email. We are on Facebook, Twitter, and the Gram. So I would love to hear from you if you have any questions about anything, any suggestions, need more information about memberships or tours. I am there. So thank you so much for your time, and I appreciate it.
Thank you, Gail. Wow, so much amazing history to see and learn about right here in the heart of West Des Moines. So love that. Next, I'm excited to introduce our supporting sponsor, Unite Private Networks. And with us today representing them is Stephanie DeVault. So thank you, Stephanie, for joining us, and thank you to Unite Private Network and your entire team for supporting this program. So with that, I'll pass it over to you, Stephanie.
Thanks, Anna. I appreciate your time. So Unite Private Networks, we've actually been in Iowa since 2011. We are a fiber provider, so we are providing all 99 county seats with fiber connections for the state of Iowa. We are traditionally known as a provider, an enterprise provider, and also we provide connection for the cell tower providers here within the state of Iowa. Recently, due to the COVID, we have seen a difference in change in our business. One of the things that we've had to do is when our customers sent their teams remotely, they're big organizations that we pushed from 5,000 remote users to 15,000 remote users overnight. Things that we're also working on right now is our wonderful governor is working a lot with rural broadband connections. As we know, a lot of our children are probably going to be on hybrid models. We also have everybody working remote right now. So how are we getting internet connections to the home, and how are we pushing broadband connections so that people can continue to work? So right now, UPN is working a lot with the rural communities to try to help support these efforts so that people do have internet or IP at their home so they can continue to work. Myself, I am affected with that, with a senior and a junior that are going to be working hybrid sitting right next to me. Let's pray to God that they can start getting out of bed before 1 o'clock and stop beating me out of house and home. But it is what it is with what we have currently. But we are happy to be a part of this organization. We're happy to have a couple minutes to talk about who we are. And we thank you for your time and look forward to continue to working with the Chamber going forward, and wish everybody good luck with the future and how our state is right now.
Awesome. Well, thank you so much, Stephanie. I'm sure this hasn't been an easy week for you and your team, so we certainly appreciate you taking the time to join us today. So last but certainly not least, I want to give a big shout out and thank you to Bank Iowa for being our presenting sponsor for this luncheon. And joining us today on behalf of them is Kyle McCormick. So thank you so much, Kyle. And again, thank you so much to Bank Iowa for all your support of the Chamber in this event.
No, it's our honor to be the sponsor and get to talk a little bit about Bank Iowa. It's interesting. The number one call I'm taking these days is, are you open? Yes, come to the bank. We have all the safety precautions out there, plexi barriers, social distancing, spacing markers, and hand sanitizers and masks for people to come to the bank, get your money, whatever services you need. We're here for you. Speaking of that, when you come to the bank, you'll notice that our home mortgage originators are uber busy. I believe 2 3/8 is the 30-year rate, and 199 is the 15-year rate right now. So if you haven't looked at your home mortgage statement to see what your interest rate is, please do so. And also, we're in the PPP forgiveness phase. I believe last time I was on here a couple months ago for the morning breakfast, I talked about the applications. Now I've moved on to the forgiveness. So we are working with people through those forms, advising what to put on your file so that you can prove you use the money for the correct purposes and helping get those forgiven. So it seems to be busy at all aspects of Bank Iowa, and we are open and looking forward to supporting the community. So thank you.
Thank you so much to everybody, Bank Iowa. Thank you so much for your support. The West Des Moines Historical Society, so interesting. I haven't been to the Jordan House in so long. I can't wait to visit. Unite Private Networks, thank you for all you do. Right now, being connected is so important, more than ever, obviously. So I'm excited to introduce Chris Nelson, who's our board chair of the West Des Moines Chamber of Commerce. And you know, this has been such a virtual world. As soon as I came on board on April Fool's Day, which, you know, seems like Groundhog Day every day, Chris and I haven't had a big chance to work, you know, face to face together because of COVID. But so wonderful to have you here on the virtual stage, Chris.
Thank you very much, and welcome everybody. Speak of the virtual stage, I know that if we were meeting in person, I would do something I'm going to do now that I haven't done since, and that is to give a shout out to some dignitaries that I see in the crowd. And I do see Mary Kramer, former ambassador to Barbados. Hi, Mary. Welcome. Thank you. Good to have you, and great to see you. It's been a long time. I'm somehow giving you a virtual hug. You're just going to have to imagine it. You know how much I miss that. And then Jamie Lettering, the assistant city manager, I think I saw her on. I am also very happy to have her here. And I know I've also missed somebody, but I know we have to get on to the introductions. So with that, I'll introduce our two speakers today. Am I still on? I feel like
You're still on. We can hear you.
Thank you. Okay, a screen moved and I'm going to have to work that out later. Liz Matney began serving as the governor's health policy advisor in May of 2019. In that role, she has assisted in monitoring healthcare access and human services policy in the state, as well as guided related initiatives. While most of Ms. Matney's efforts previously focused on legislation and policy within the scope of the Department of Human Services and the Iowa Insurance Division, it has been necessary to adapt to the needs of the state during the pandemic. Since COVID-19, she has been dedicated to a one-team approach while leading the governor's office pandemic response for long-term care facilities. Previously to her role in the governor's office, Ms. Matney served most recently as the bureau chief for managed care oversight and supports within Iowa Medicaid. She attended Texas State University as an undergraduate and Drake University for her graduate studies. Currently, she lives in West Des Moines with her family. I also want to introduce Joel Anderson. Joel is the tax policy advisor to Governor Kim Reynolds. In his role, he is responsible for advising the governor regarding any decisions for the subject of taxation or revenue in the state of Iowa. During the COVID-19 pandemic, Joel is responsible for helping manage the economic impact to the state and crafted many relief programs for individuals and businesses. He is also liaison from the governor's office to the Department of Revenue, Iowa Economic Development Authority, and other state agencies. Joel is certified public accountant, and prior to joining Governor Reynolds' staff, worked at the accounting firm of RSM. It is an honor to introduce to you Liz and Joel.
Thank you, everyone, for having us on today. Liz, are you on too? I don't know if you're having some trouble.
Hi. Hello. Thank you for having me.
Gotcha. Sorry for joining a little bit late and did not get to hear all of the introductions from the other groups as well. Just got off the Governor's Economic Recovery Advisory Board that met from 9 to noon. And I can talk about that too, but really quick, since Bank Iowa is on, I do want to shout out to them, especially on their work with the Paycheck Protection Program. One of the very cool things about Iowa during that was we are in the top 6 states for amount of paycheck protection programs going out. And that is directly related to our banking system and how well connected our businesses are to their banks. And so Bank Iowa, just really want to thank you for that. So I will kind of let Liz go forward, and we can have Liz talk more on what she's been dealing with for COVID this first half, and then the second half I can kind of give an update on that. But just wanted to get that thank you out right at the beginning.
Hey, thanks, Joel. So good afternoon. My name is Liz Matney, and as Chris said, I'm the Governor's Health Policy Advisor. So previously, before COVID, and still, my main portfolio consists of the Department of Human Services and the Insurance Division. So that's a pretty broad breadth of government programs. But since the pandemic started earlier this year, a lot of my focus has kind of pivoted and shifted back and forth. We still have business as usual, but then there's other focus areas that require the governor's office leadership. So one of the best lessons that we've learned out of this is just how flexible really we are as people. We had a pretty steady routine of business that we were tackling each day, and then COVID came along and all of our lives changed so dramatically. We changed where we worked, we changed how we worked, and we changed, some of us, what we were working on. So it's been a pretty big life changer for me. Nothing like this has happened in my lifetime, and probably none of yours as well. So I'm trying to absorb all of the lessons I can and use those for my career and my personal life moving forward. But specifically to COVID, when it became bigger and bigger on our radar, really at the beginning of 2020, we were watching it really closely. We were poring over all of the global data. We were reading as much literature as we possibly could. And honestly, the most consistent theme at the beginning was that there were more unknowns than knowns. It's a pretty discouraging place to be when you want to plan strategically, but nonetheless, there we were. So when we did start identifying cases in Iowa, our team rapidly mobilized, and we were at the Emergency Operations Center in Johnston for the next few months. And although Joel and I worked really closely in months previous, this was the closest we had ever worked. So we went from working really across the office in our own individual offices to working every single day at the same table, which was quite a big change for everyone. So when we were there, we met throughout the day, every day, really just running interference and continuous loops of identifying issues and problem solving. So in doing this, it was incredibly critical to working with our partners in the healthcare industry, as well as our business partners, and as Joel will highlight later, to create solutions to issues that none of us really had ever seen before. Thankfully, a lot of us are in the roles that we're in because we like challenges and we love problem solving. But let me tell you, I have witnessed some of the most amazing creativity and best collaboration in my career. So, like I said earlier, that's going to be something that I'm just going to carry forward with me. While I have worked on a variety of different areas during our COVID response for strategic planning, from emergency childcare to telehealth to emergency food assistance, today I'm going to focus, as Chris had mentioned earlier, on my work with the long-term care response to COVID. The nature of long-term care, just in general in nursing homes, is that they care for those that are most vulnerable. So for one reason or another, people live in nursing homes because they cannot take care of their daily needs in their own homes. These are people that have high-risk medical conditions, are frail as a result of the aging process. They might have some memory-related conditions, or they might actually have a disability. So as we've seen, not only in Iowa, but across the nation, due to all of these reasons and the close nature in which they live, this really is an environment that has seen some of the most heartbreaking effects of COVID. So our first goal ultimately was to contain COVID spread within those facilities as much as possible. So we had a tool chest that we really had to develop pretty quickly that consisted of some staffing protocols, really doing enhanced screening of anybody coming in and out of the facility, and in fact limiting traffic in and out of the facilities as much as possible. Testing for COVID and working to ensure that everyone that was working at the administrative level in those facilities, to the nurses, to the CNAs, to the janitors, everyone had the tools they needed to identify and prevent spread. So this really required all of us to work collectively to ramp up testing, PPE production and distribution, as well as acquiring and distributing cleaning supplies in pretty rapid order. So in the midst of all of this work, we are having national shortages with all of those things. So we were short on the tools that we needed to be successful, but yet, again, I can't emphasize this enough. That is the time when I saw really amazing ingenuity and collaboration. We saw companies across the state flex their own operations to make PPE and things like hand sanitizer, and without them, I honestly don't know what we would have done. So from a testing perspective, I think we have heard a lot on the news and read a lot about how critical testing has been in handling the COVID response. So we tried to tackle testing in truly as many ways as we could. When we began, we had basically one source alone, very, very critical resource, and that's the State Hygienic Lab out of the University of Iowa. So you can probably remember when we initially started testing for COVID, we had a pretty limited criteria for getting those tests, and that's simply because we didn't have the capacity to do broad-based testing that we have today. But slowly, and sure enough, we saw some private testing come online, which was critical. Testing in nursing homes was challenging, not only from supply, but just like simple resources. We could get the tests and PPE to each one of the nursing homes to test, but the process of testing all of the residents and staff was just draining from a resource perspective. So if you have one nurse or two nurses out of your nursing staff of 30 doing testing, and you're planning on testing 100 residents and 30 staff, I mean, that takes basically 2 full days for that nurse, those two nurses' time. So we wanted to work to think of other more strategic and proactive ways to help those nursing homes with those resource issues and help them get their staff tested and residents tested in a better way. So we began looking really strategically across the state at counties where we were seeing higher cases, where the positivity rates were higher than maybe other areas, or just really where we suspected that the virus was going to spread next. And we implemented what we called as strike teams. So we did this not only for long-term care, but we also did it for our manufacturing plants, our food production plants, and other businesses. So those strike teams were really a partnership between the National Guard, the Department of Public Health, the Department of Human Services, and the Department of Inspections and Appeals. And all of those people together would go out to a county, they'd set up a location for a day and a half, and within that day and a half period, we test hundreds of nursing facility staff within that county so that the nursing homes didn't have to worry about that themselves. We've progressed a little bit, and you know, the strategizing and work that we're doing on testing is never going to stop. As Test Iowa came online, we were able to create a fast track for healthcare workers, including our nursing home staff, to get tested rather than going through the qualifying criteria. And since then, we've expanded the Test Iowa criteria further. So now everyone that wants a test really ultimately can get one. We also continue to engage our strike teams while we still had our National Guard support. Now that's scaled back quite a bit, so we don't have that support any longer. But what we have seen is a lot of our local public health entities stepping up and organizing themselves, which is so greatly appreciated, and conducting their own strike teams for nursing homes across the state. So finding other ways to assist nursing homes with those resource struggles. Most recently, we're pretty excited and thankful for efforts and planning from the federal government to get rapid testing into nursing homes across our state. We haven't gotten any delivered yet, but we're hoping to in the next week or two. And really every tool is going to help with this fight. But testing has only been one piece of the puzzle, and we're trying to really tackle it from all angles. So while we did need to focus on giving nursing homes the facility and guidance they needed to operate safely and implement creative strategies, we also needed to help them think about how we could not only keep individuals in nursing homes safe, but also pay attention to their quality of life. So there were several months where essentially nursing homes were closed down to anybody going in and out that wasn't essential to the operation of that nursing home. So a lot of nursing home residents had not seen their loved ones face to face for quite a while. And we know that that has a very serious mental health and physical impact on those residents. So during that course of time, though, we did see a lot of nursing homes implement pretty creative strategies. They had window visitations for residents and their families. They created and worked with actually businesses in their community to create basically portable rooms called chat boxes that had plexiglass where nursing home residents could talk to their family members through that plexiglass. But we know that those aren't really replacements for face-to-face interaction and physical contact. Our state Medicaid program also distributed hundreds of thousands of dollars to facilities to purchase technology for virtual visitation with loved ones. But again, we know that we needed to make progress in getting people face-to-face. So we still work. Earlier in June, we released some guidance on how nursing homes could ease restrictions so that visitation could begin. Honestly, we're approaching this very conservatively because we know that we still have virus activity in the community. We still need to be really careful, and we don't want it to get into nursing homes. But we also want to think about balance. So balance is key as we move forward. Our guidance and all of our work with our nursing home facilities and the people that they serve is really an evolutionary process. What is in place today might not be true next week, and we're continually learning and trying to implement process improvements so that we're getting to that sweet spot where we're not only keeping people really safe from the virus and being proactive and strategic, but we're also thinking about how we can make people's lives better. So every single day I have several phone calls with a range of different people, from administrative staff with nursing homes to constituents to other leaders within our state at the agency level, thinking about ways that we can control the virus while also making lives better for our island. So what I've seen is a lot of passion, seen a lot of hard work. I've seen a lot of collaboration that might not have been there before, so a lot of relationship building. I'm just so grateful that there have been so many people truly passionate about the state, and the people that live here. So I guess I'm really, really grateful that you guys invited us to come and talk about the work that we're doing. And the thing that I do want to leave with you all is that regardless of what you're experiencing out there and what issue you might have, as we are experiencing a pandemic and as of Monday, a natural disaster, myself and Joel are always a resource. If you need anything, feel free to give us a call.
Thanks, Liz. I will kind of jump in really quick. I know I want to try to keep to 5 minutes so we can do some Q&A. But I'll talk about one of the things. So March 17th was the first public health proclamation that the governor did, really shutting down businesses from a wide swath of the economy. So one of the things that we had to do right away was see how can we step up and support. And this was before the CARES Act was passed. This is before we had any federal funding. Thankfully, the legislators had given the governor authority to spend up to roughly $17.9 million of the Economic Emergency Fund. And then working with Director Durham and IDA and IFA, we were able to kind of find some more funds. So originally we thought that $4 million was going to be enough for this impact, exactly as kind of what Liz said was we just had a lot of unknown variables. So we try to looked at standing up the Small Business Relief Grant Program. A lot of people on here probably have worked with IDA in the past, know that IDA is great at getting out large sums of money and great at trying to check the box and look through everything. You know, if you can get a project through IDA in a 4-month time frame, you know that is blazing fast. We did not have that. We had hours. So we had worked round the clock. I kind of had an office out at Bell Avenue, had an office at SEOC, and went through between those two locations. And we stood up the Small Business Relief Grant Program with that $4 million. By the time we actually got the original round of funds, it was about $125 million that we needed. By the time it actually closed, it was around $240 million that was needed. So we were able to go back, show just the preliminary numbers to the governor. She moved 17 million more. Director Durham was able to find some more money, and we got up to that 24 million. And that's when we started trying to get that money out the door as fast as possible. Thankfully, the CARES dollars did come in mid-April. And so we were able to use some of that to backfill that, and we actually increased the cap to about 94 million because the other lifeline that really did save a lot of our businesses was that Paycheck Protection Program. And so that last count, there's about $5.4 billion, 5.4 billion flowing through the paycheck programs in Iowa. And so that was really the lifeline there. And so we wanted to make sure the Small Business Relief Grant was able to go through and do that. The other people that usually individuals don't like talking to is the Department of Revenue. And I made sure to bring in Director Paulson right at the beginning and said, you know, no business is going to shut down in Iowa due to a tax obligation. And so we made sure to work with everyone that we could to do deferment of taxes. Unfortunately, we do not have the authority or the power to waive or forgive any tax debt. That would be the prerogative of the legislators. But we were able to say, we will work with you to waive penalties, waive interest, do a payment plan, and a lot of that. And so we worked one-on-one with a lot of taxpayers. But I think what happened by doing that, we also tried to make sure that businesses were able to get as much resources as possible. What was great about that, and I know you don't feel this way necessarily sitting here and only looking at Iowa, West Des Moines, but the Council of State Governments came out with a report that they commissioned with KPMG Iowa is the most resilient state in the nation, and we have the least amount of risk due to the COVID-19 impact. And I really do think it's because of organizations like the Chamber that were able to deploy all that information as possible. We got money flowing to individuals. We were able to help shut down businesses, but still keep them open, getting money go through. Restaurants and bars were the ones that were hit the hardest, and so we made sure everything we could. So letting licenses be extended, cocktails to go, curbside. There was a time there where every other day we had a new proclamation coming out, with a lot of it being just what is another idea that DIA brought to us or ABD brought to us or something, of saying, here's some relief that we can give while this is going. And so I really do want to commend the chambers. Worked with the Iowa Chamber Alliance a lot. Dustin Miller and I were texting until 2 in the morning, 3 in the morning sometimes, of what is this idea? How can we do this? How can we get this information out? So I really do want to thank your organization. I know you've been helpful on that. I can keep on going on and talk about more, but I want to open up to Q&A. And if you have any other questions or you want to follow up or have ideas, as Liz said, please do not hesitate to reach out to us.
Amazing, Joel, incredible. Liz, your stories and support, doing all you can right now to help Iowans, to help our businesses. It's so critical. Obviously, this is a tough time. This is my first pandemic, so I don't know about you guys, but yeah, I think it's most everybody's first pandemic, right? So, I love, though, the quick thinking, the innovation around what can we do right now? How can we pivot very quickly? That is the word of the year, by the way, pivot, obviously. And it's so nice to see, hear that Iowa is the most resilient state in the nation, that KPMG study. That's so interesting. I need to find that online and dig into that. That's really cool. And you're right, us as a chamber and many other chambers and the Greater Des Moines Partnership, we're all trying to figure out quickly, how can we help businesses? How can we support? And we've certainly tried to do all we can in that vein. So thank you. And thank you to that Small Business Relief Grant Program. Amazing. And the PPP. Yeah, just so helpful. I am excited to introduce now Kara Matheson, who heads our workforce development efforts at the Chamber. And she is our Chamber champion. She's been with us for 1.5 years. So she is a Chamber brain that we're all asking her questions because everybody else is new at the Chamber. So we love Kara so much and lean on her greatly. So Kara got promoted to this role right after I started because I realized she is just an incredible asset to the Chamber and to the community. So I am going to pass the virtual stage on to Kara.
Well, thank you, Catherine. Yeah, it's been a lot of fun. We love this new team. So thanks to the whole team. I know to use that word that that's kind of the buzzword of 2020, we've been pivoting. As I know, Liz and Joel, you have too. There's no playbook or something like this. So thank you for all your work and your effort in supporting the all Iowans and all of our different communities. So with that, let's go ahead and open it up to Q&A. If anyone wants to throw some in the chat, go ahead and do that. In the meantime, I've got one I thought we could start out with. And we just wanted to know if you could speak on, the progress of a vaccine in general, or maybe if there were to be one found, what the plan would be for dispersing that. Is that something you guys are working on right now?
Definitely. I think it's so preliminary still. Globally, we have vaccines that are in trial, but it would still have to go through an FDA approval process, which does take a bit of time and other trials. So I think that from our perspective, we're still quite a ways away, but we would be, you are working on a plan for that. Absolutely.
Awesome. Thank you. And then is there a plan I know the future is uncertain, but is there a plan to try to contain the spread in the winter months that are ahead?
Yeah, I think that what we are absolutely encouraging is for people to be extra mindful of getting their flu shots. just so we can keep everybody as healthy as possible as the virus does continue to be alive in the community. A lot of us have done a lot more outdoor activities lately because that's what's frankly open for us to be social and to have fun. So as the weather does deteriorate, we'll be thinking about other guidance and ways that we can continue to operate indoors, but still continue social activities that we all need for things like mental health. There are some studies. I think it's called it's a survey that operates on a monthly basis through the census pathway. Before the pandemic, if I'm recalling correctly, in Iowa, about 15% of people reported that they experienced depression and anxiety on a regular basis. We're up to almost 40% right now. So it is a really big spike, and we have to be mindful of that as we're moving forward as well, and have things for people to do.
Right. So you mentioned the importance of mental health. Do you have any resources you could share with the group regarding mental health during these crazy times?
Yeah, we have materials that we put together. I can certainly send those over to Bailey and make sure that she can distribute those to the group. But there are, we're pretty fortunate that in the central Iowa area and Polk in Dallas County, we have a pretty good mental health system, but statewide, you know, there are gaps in mental health services. So pretty rapidly, Joel mentioned the proclamations that would come out every other day. One of the best and most impactful ones that were related to mental health was the opening up codes and creating parity for telehealth. So we've looked at how, I mean, really telehealth has exploded since the pandemic started. So a lot of people are accessing mental health services through that as well. So I'll get that package of information sent over to Bailey so she can share with the group.
That would be awesome. Thank you. And Bailey said, yep, she will include that in a follow-up email to go out to everyone. So thank you, Bailey. And then we do have another question. Do you have a recommendation on what type of masks work better than others through research you've done or seen? Material-wise, how many layers?
Yeah, I'll see what public health has in terms of like a ranking. Obviously, N95s are the cream of the crop when it comes to masks. But at this point, just because of some resource scarcity, really any cloth covering of the face is going to be beneficial when you can't social distance.
Okay.
The less porous, the better.
Okay, good to know. And I believe the chamber will have some masks available here soon, so we can, as those become available, we can send everyone some information. They've got some kind of fun sayings, because hey, if we're going to be wearing them for a while, we may as well look good wearing them. So I just want to say thank you to you two before I pass it over to Catherine. It's so informative and great that you were able to take some time out of your day. We really appreciate it. So with that, I'll send it back to you, Catherine.
Thank you so much, Kara. Really appreciate it. I am now excited to turn the virtual stage baton over to Nicole Langmaid. And Nicole and I started, I think, almost on exactly the same day. So we've been in this together since day one. And Nicole handles our accounting, IT, operations, our surveys. She has a long title, but she does so much at the chamber. So take it away, Nicole.
Yes, thank you. I'm just going to go over a few upcoming events to be sure to write down to sign up for. The first coming up next week is on Tuesday the 18th. It's part of our business survival from the pros, and it's a free event. It'll be that morning from 8 a.m. to 9:30 a.m. And then our popular annual event, Mentoring for Women, will be August 26th. We have an outstanding list of mentors this year. You can find more information on our website for that one. 2 events that are coming up next month to just kind of pencil in your calendar. They're back to back. The first one is our First Responders Appreciation Breakfast, which is going to be keynoted by retired Navy SEAL Lieutenant Jason Redman. And then on September 9th, we'll have our September Luncheon with Jamie Pollard from Iowa State University.
Love it. A lot of stuff going on. No moss grows underneath our feet, that's for sure. Especially when COVID hit, we realized we had to pivot and really do a lot of new things, new programming, because that's going to be key to keep our businesses surviving right now. And we did a fun exercise. If you can see my screen, the chamber team did a fun exercise this summer at a 2-day all virtual retreat. We came up with our mission, our vision, our values, and our goals for the chamber. And we love our vision so much. It's really to make West Des Moines the best suburban city in America to live, work, and play. And everything we do is around those 3 buckets: living here, working here, and playing here. So we're highly laser focused on that, and that will become a reality. And our goals are to keep our area companies in business, our employees employed, and our region strong, especially now. So that's super critical. And on the left side of your screen, you can see we are working on a membership drive this fall, and we are working on ways to tell the chamber story. We are here to support businesses. We help businesses grow, and that is our mission in life. So these new brochures will help paint that picture and tell the story of the chamber so people can understand how to best plug in. I would now like to turn the virtual stage over to our board chair, Chris Nelson.
Well, thank you very much. Thank you, everybody, for taking time out today and making this part of your day. Thank you very much to the staff, Bailey, Nicole, Anna, Kara, and our President and CEO, Catherine. Thank you so much. You guys have done such a great job at a time where, there's no script written. You're right. Everybody, a lot of business, just like the businesses we serve, you're writing the script as we go and doing a phenomenal job. Everybody, I hope you have a great day and a great Friday tomorrow into a great weekend.
Thank you, everybody. Thank you, Liz. Thank you, Joel. Thank you to our sponsors. Thank you so much.
Thank you.
Have a wonderful afternoon. And we're ending 3 minutes early. We gave you the gift of minutes, 3 minutes, the gift of time.